Hey people, just going to give it a few more moments for some more people to join on. How y'all doing? I can't see. So for those of us just joining on, I'm just going to give it a few more moments to allow some other teasers to join on, and then we'll get started. All right. Hey teasers, welcome back to another episode of Birds, Bees, and Tease. And thank you all for joining me on Instagram Live to honor, commemorate, celebrate, and observe World AIDS Day 2020. This is such an important day because this gives us an opportunity to honor survivors, to remember and honor people who we've lost to this epidemic. It gives us the opportunity to talk about HIV stigma and prevention and what we need to do to keep this work moving forward. And it gives us the opportunity to raise awareness. I never, as a sex educator, I never assumed that, everybody is on the same page. And that we're all talking about the same things and that we all have the same understanding. And that's something that's really important that we do. It's important that we meet people where they are, and so that we can really move forward and get this work done. So thank y'all so much for joining me on this. And the live will be interactive. So if y'all have thoughts, feelings, questions, comments, reactions, anything that you would like to say, definitely please drop it in the chat box or in the comment section, and I will share it with the audience and make sure that your point is noted on the episode. So yes, today, December 1st, is World AIDS Day. This day is celebrated every year on December 1st, and it was first celebrated in 1988 when the HIV epidemic first hit the scene. It was really drastic, and there was very little awareness. There was very little resources. There were very little resources. There was not a lot of care going on, and just a lack of information and knowledge. And so that is why this day how this day came about. And the theme for 2020 is ending the HIV/AIDS epidemic, resilience and impact. And so we're going to talk about that today and what that means and what that looks like for us, people, living in the community, because this is something that was put together by the Department of Health and Human Services, which is responsible for the public health of all Americans. But what does it mean, to us, the everyday person, people who are just living their lives? Many of the listeners are millennials, so we grew up learning about HIV and what does that mean to us now? So we'll talk about all of those things today. So I like this theme, resilience and impact. I like what they're saying there, and I love that they're keeping the focus on ending the HIV epidemic. I think that using the word resilience is so important, especially in 2020, where we are fighting COVID-19. We're in the midst of an economic crisis. We're still kind of going through a crazy election process because y'all president won't let it go. So being resilient is going to play a large role in working toward ending the HIV epidemic as we close this year, and also moving forward in the future. So it's really important that we talk about like what that's going to look like for us. So today I participated in a webinar, I guess you would say, about World AIDS Day, and it was led by Harold Phillips, who works at the Department of Health and Human Services. It was also, there were also other panelists on there, a Black woman who is an HIV survivor. There was a young Black male who was on as well, and who is an advocate for PrEP, and we'll talk about that as well. And then there was also representation from the leader of the HIV division at the Centers for Disease Control. And so I appreciated the very diverse very diverse panel in the group of people that they had, and especially that they had Black people and Black people with other intersecting marginalized identities to be a part of that conversation. That was really helpful, and I learned a lot from them as well. So I'll talk about some things that I learned from that conversation and what happened with that as well. So on this episode, I want to really highlight a few things. I want to talk about HIV generally and provide some education, because that's what this is about. That's what this podcast is about. And then I also want to have some conversations around reducing stigma and raising awareness, and then also supporting our HIV positive loved ones. Okay? So the first thing I'll talk about is HIV. I don't assume that everyone knows all the information or all there is to know about HIV. And something else that's really important is that the information that we learned from the 80s to present has changed so much. The HIV virus and how we care for people impacted by HIV and everything has changed so much, and it continues to change. And so I'm sure that some of the information that I present to you all will be new today, because this is changing so much. So it's really important that we keep ourselves aware of this and understand that it really is something that impacts all of us. And we'll talk about that as well. I don't want to get too much into it. So HIV is human immunodeficiency virus. It is the virus that causes AIDS, acquired immune deficiency syndrome. So HIV and AIDS are not the same thing, and I won't get too technical about the differences of the two, but that's the most important thing that you would need to know about that. HIV is most commonly spread through unprotected sex, through intravenous drug use by like sharing needles, and then it can also be passed from mother to baby, either through the birth canal or through breastfeeding. However, technology is awesome, where the innovations that have been introduced since HIV, really came on the scene. There's been so much medical innovation that has allowed mothers and pregnant people to deliver healthy babies safely without passing HIV to them. So that is something that is really important for us to note as well. HIV can only be passed through 5 bodily fluids, and those include blood, semen, pre-ejaculatory fluids or pre-cum, vaginal fluids, and then anal secretions or anal mucus. So many of us received horrible sex ed growing up, whether it was, in school or whether it was, from a family member who also received horrible sex ed, and we learned a lot of things that are just simply not true about HIV. And so I wanted to clarify those things for all the listeners and for everyone, and just to give a refresher, because many of us know this information already. What else do I want to say about HIV? HIV can be prevented. The transmission of HIV can be prevented in so many ways, which is why it's important that we have this conversation, so that we can reduce the stigma around it, and then also talk about these prevention methods. Most commonly, not participating in unprotected sex. So this means using internal or external condoms or barrier methods like dental dams when participating in vaginal, anal, or oral sex, or any type of sex where those bodily fluids that I named would be, where a person would come in contact with those bodily fluids. Not sharing needles or syringes, of course, is a way to prevent the spread of HIV. And while we think that this is something that may be far off, we're actually seeing intravenous drug use really resurface in young people. And when I say young people, I'm including myself in that. So, people who listen to this podcast and the younger generations for sure, intravenous drug use is resurging. So it's really important that we bring this back on the table and talk about it. So yes, those are two very common ways that we know to prevent the spread of HIV. But there are some new methods as well that you all may not know of. One that is really important and that you may have seen commercials for on TV is PrEP, or pre-exposure prophylaxis. This is a medication that prevents the spread of HIV in HIV negative folks. So essentially how it works is that a person takes a pill a day, and this reduces their risk for contracting HIV through sex. And so this is a really important campaign that's happening right now, and something that we all should be aware of, considering the fact that all sexually active people, especially sexually active people of color, are at increased risk for HIV. So I encourage you all to do your own research on PrEP. Talk to your healthcare providers about it. And it may be something that you even introduce to your healthcare provider, because, in America, we hold doctors on this grand pedestal, but really they don't always know all the information. And a lot of times, they're waiting on information or guides to be passed to them from the CDC or from other, large organizations. But really us opening up the conversation will really push them forward to take better care of us. So talk about PrEP with your doctors. Some things that were discussed on the webinar that I participated in today, they talked about, PrEP only being targeted for people who identify as LGBTQ+. And while that community, and we'll talk about this as well, why that community or those communities are at increased risk, PrEP is for everyone. And so I encourage you all to definitely learn more information about that, because we haven't seen this before until more recently, where a person could take one pill a day like a vitamin and drastically decrease their risk for contracting HIV. So PrEP does work, and so you all can, the national campaign that's happening is called Ready, Set, PrEP. And you can find more information about this at getyourprep.com. Getyourprep.com, okay? So yes, and then another prevention method that I want to talk about and introduce to many people is the U equals U campaign, or U equals U. The letter U equals the letter U. And this means undetectable equals untransmittable. So let me explain this and break it down to you all. When a person is diagnosed with HIV, they are then offered or enrolled in a perfect world into some type of care, into care that will allow them to receive medicines, have frequent doctor's visits, and things like that to manage and control their HIV. And this, in many ways, once a person is diagnosed with HIV, the management of it is very similar to a chronic disease. And nearly 50% of Americans are presently living with chronic diseases, where 25% of Americans are living with at least two. So managing is a big part of the HIV diagnosis, the management plan. So if a person is managing their HIV, they are, being treated through the medications. They are maintaining a healthy lifestyle by, what they eat and managing their stress, all the things that are relevant to all of us. Then their viral load, or the amount of HIV that is in their bodies, can be suppressed so low that it is undetectable by an HIV test. So I'll say it again. Undetectable is when a person who was diagnosed with HIV has been on their medicines, doing their treatments, and taking care of themselves, and having frequent doctor's visits, and to get control of their HIV status, to suppress their viral load, or the amount of HIV that is in their bodies, so low that it is undetectable by an HIV test, or undetectable in their bodies. So the newest prevention method is undetectable equals untransmittable, meaning that if a person is undetectable, their HIV status is undetectable because it's under control and they've been treated, or they are being treated, that it is impossible for them to transmit HIV to another person. This is groundbreaking, y'all, which is why I keep repeating the same things over, because I want everybody to hear it. If a person has control of their viral load, or they are experiencing viral suppression, they are incapable of passing HIV to another person. This is so important, so important. This does a lot for, this basically means that when people receive HIV treatment, that it stops transmission. So this is why we have to get rid of the stigma, y'all, because a person could be living with HIV and, we've been taught our entire lives, HIV is a death sentence. HIV is so bad. It's so terrible. Your life is over. That can force a person out of treatment. There are several other factors that force people out of treatment as well, and we'll talk about those. But when people are getting treated, it stops the transmission of HIV. And that is our goal. That is how we end the HIV epidemic, by stopping transmission. And this campaign, the U equals U campaign, also brings people back into care. People who, have kind of given up, or people who thought, there's no hope for me anyway. There's nothing that I can do for to get better or anything like that. So that brings them back into care, to really allow them to live their lives healthily, happily, and normally. And really, give them the care that they deserve and that they need. The HIV survivor who was on the webinar that I mentioned earlier talked about what this does, what U equals U does for internal stigma, for people who are living with HIV and have internalized the stigma that we have learned all, our entire lives. And so, this gives them a second chance at love. This gives them the opportunity to have sex and engage in sex safely and enjoy it. And gives them the opportunity to have children. The spokesperson, she was awesome, and she shared that, being able to make love to your partner and produce a child from that, and everyone remains healthy and safe, how rewarding that is. And so that was just that was beautiful to hear, and just beautiful to be a part of. So I encourage you all to do more research. You all may have already seen it or heard about it, depending on where you live. and what you do professionally as well. But the U equals you campaign, undetectable equals untransmittable. Really important stuff. And I may come back to that a little bit later. I'm following all my notes. So this is what a live episode looks like. It looks like notes and my microphone, my laptop. I have like several tabs pulled up. So I might come back to that later. But if y'all have questions, comments, thoughts, feelings, any reactions to that, please drop them in the comments. Because I really want to know what you all think about it, especially if this is your first time hearing about U equals U, and what that is like for people who are working in sex education. How are you doing the U equals U work that needs to happen? All right, so we talked about HIV and we talked about prevention. And so let's talk a little bit about why I say that this is an issue that we all should be focused on and why it's something that we should all care about. Pull my notes up here. So on the hiv.gov website, I encourage you all to check that out. They have information about World AIDS Day specifically, and then also like up-to-date statistics and facts, quick facts that you can catch up on about HIV. One thing that is mentioned on there is their plan to end the HIV epidemic by 2030. So what that means, it doesn't mean that there will be no HIV globally by 2030. That means that the rate of transmission will decrease dramatically, and that the number of new cases that come up every year or that are diagnosed every year will decrease drastically as well. So that's what we mean by ending the epidemic. And this plan is also listed on the hiv.gov website, the full plan. So how they plan to do this, they have like a 4-prong plan. They plan to diagnose more people, to treat more people, and we talk about how important treatment is because treatment prevents transmission. They plan to prevent by continuing the efforts that have already been put out, but also with things like PrEP, the PrEP information, and ramping up some of the efforts that have been put into place before. And prevention also looks like needle exchange programs. It looks like just giving funding to underprivileged communities, things like that. And then responding. So diagnose, treat, prevent, and respond to any new HIV outbreaks in communities. And we see that a lot in rural communities today, and then in very urban communities where there are high populations of Black and Latinx people, and especially Black and Latinx LGBTQ plus people. So they say that on the hiv.gov website, they say that there's a real risk for HIV resurgence due to several factors, including a resurgence in injection drug use, which I mentioned already, HIV-related stigma, which we've already talked about and we'll talk about more, homophobia, lack of access to HIV prevention, testing and treatment, and lack of awareness that HIV remains a significant public health threat. And I like that last point that they brought up because it allows me to tie in race and racism. If y'all know me personally, y'all know that I'm kind of like a race warrior. I really understand. I really center the plight of Black people in a lot of my work, and I've oftentimes feel the weight of my ancestors, and so I can see it in everything that we do. And HIV is a race issue, absolutely. So this last statement says that there's a lack of awareness that HIV remains a significant public health threat. And this is because the public health community has done such an outstanding job with addressing HIV, with the number of cases that we have each year and things like that. However, while HIV rates have declined for the population as a whole in the U.S., rates in African American communities continue to rise. I'm going to say it one more time so y'all can see how crazy this is. As a population as a whole, HIV rates are declining. We're doing better when you look at just that alone. But when you get into these subcategories of race, gender identity, and sexual orientation, you will see that there are certain communities that are still experiencing HIV at increasing rates. And that includes Black and Latinx communities. That includes Black women, Black cisgender women, and then also Black people who are LGBTQ plus. So this is what it looks like on a large scale. White women experience their lifetime risk for HIV. So over the course of their entire life, 1 in 880 white women will contract HIV. That means if you get 1,000 white women in a room, there is likely that only one and a half, 1 and 3/4 of the women present will be an HIV survivor or will ever contract HIV. In white men, it's 1 in 132. In white men who have sex with other men, or MSM, it's 1 in 11. So we see the disparity there happening greatest amongst LGBTQ plus individuals, or as the CDC says, men who have sex with men. Now, I want to address this really quick because men who have sex with men is not a sexual orientation or any type of sexual identity. It's a term that the CDC uses to encompass everyone who they say, or everyone who self-identifies as a man who participates in sexual activity with other men. Okay. There's a comment in the chat that says PG County has the highest incidence rate in the state of Maryland. So PG County is a very Black county in the state of Maryland. I believe it is the blackest county in the state of Maryland, and it also has the highest incident rate of HIV. Thank you so much for sharing that, Jalen. And so y'all see the correlation there. In Black communities, HIV incidence is greater. So I'm going to keep reading the stats for y'all. In Hispanic or Latinx people, the lifetime risk for HIV among cisgender Hispanic or Latinx women is 1 in 227. In Latinx men, it's 1 in 48. In Latinx men who have sex with men, it's 1 in 4. So 25% of Latinx LGBTQ plus men identified folks, and then also MSM because of transphobia and just how things are reported. That also includes trans people, oftentimes trans women. So 25% of LGBTQ plus Latinx people will contract HIV in their lifetime. Do y'all understand how crazy that is? 1 in 4. All right, and then now let's talk about Black people. Black women, Black cisgender women, the lifetime risk for us is 1 in 48. If 100 women gather in a room, at least 2 women will be living with HIV. These are women who, could be in monogamous relationships, women who, have the same lifestyle as white women. White women, it's 1 in 880. Black women, it's 1 in 48. I need y'all to understand how deep that is. That is crazy. In black men, this is cisgender men, heterosexual men. The lifetime risk for HIV is 1 in 20. 1 in 20 black men, 1 in 20 straight black men will will contract HIV in their lifetimes. And this last statistic, it literally broke my heart when I first learned this. I was at the North Carolina Sex Conference, or NC Sex Con, and I had to step out of the room when I learned this information, because I carry the weight of black people, and this just broke my heart. Black men who have sex with men, there is a 1 in 2 chance that they will contract HIV. 1 in every 2 black LGBTQ plus men will contract HIV in their lifetimes. That is crazy as hell, y'all. That is insane. That is sick. It's painful. It hurts. It really hurts to know that is happening to people who we admire and who we love and that we're so connected to. And also, this is men who have sex with men. This is this category. And so we don't always know who that is, right? We don't know what people are doing behind closed doors. But 1 in 2 black men are likely to contract HIV in their lifetime. So when I say that HIV is a race issue, this is what I'm talking about. 1 in 50 black women, 1 in 20 black men, 1 in 2 gay black men, 1 in 4 gay Latinx people. So you all can see how, the stigma and the homophobia, the things that were mentioned earlier, play a role in this. It's crazy. It's literally crazy. I see some comments in the chat box, and I want to respond to this. I see a lot of wows. Yes, that was my response as well. Like, it's crazy. These numbers are insane. Absolutely. Okay, good question in the chat box. What advice would I give to a public health professional who is not necessarily working in HIV/AIDS and helping address these issues, particularly around stigma? Thank you so much for that question. That is an awesome question. And I want to put a pin in that, because we're probably going to come back to that later. Not probably, we're absolutely going to come back to that later. Because we need to talk about like how interconnected HIV is with so many other public health issues. And on that note, I'll kind of swing into COVID-19 because that's something that's so relevant and impactful and something that's happening like right now to us. So I want to, give everybody a moment to kind of like sit on that information, and then also like take a break if you need to, because that is heavy. That's really heavy. I know that was really heavy for me when I first learned that information. And, like as a Black person, we deal with so many other issues. We deal with so much other shit. And to, know that this epidemic is continuing to impact our people exclusively because of race and racism, it's really hard. It's really hard. It's really hard to deal with there. I also want to, I got a little hot, y'all, so I'm fanning myself off with my fan from the Gansey. I'll take this moment to support and promote a Black business. If y'all don't follow the Gansey on Instagram, make sure that you definitely do this. This is an online magazine, online fashion magazine. that is spearheaded by my dear friend, Melquan Ganzi, and he really ties fashion to a lot of social issues that we face as Black people. So make sure y'all check out the Ganzi. And this particular picture, there was an article associated with it that I wrote. So y'all make sure y'all check that out on the Ganzi's website. Okay. All right. So let's keep going and let's talk about COVID-19 and HIV. I want to get into this because there are public health people who don't necessarily work in sexual health, but work with other issues. And we need to understand like how COVID-19 is impacting HIV, especially, and how these two are related and how they're not. And I'll start there because since COVID-19 has started, the jokes have been flying. We've been using social media as a tool to really get through COVID-19, and the jokes have been flying. And I've actually seen a lot of jokes that compare HIV to COVID-19, or just making light of, these situations. And personally, for me, HIV jokes will never be funny. They're just not funny because y'all just heard those statistics. This is not a joke. Like, this is not something that we can be playing with when we're talking about 1 in 20, Black men being diagnosed with HIV over their lifetime. It's just not funny to me. So COVID-19, comparing it to HIV, y'all, is really insensitive, and it's just not factual. So it's important that we don't do that. And that's one way that we can fight against stigma, by not comparing this epidemic to this global pandemic that is out of control, that hit us out of nowhere, that no one has any idea how really to respond to, that our government officials are refusing to respond to. It's just really not comparable. Okay, so let me say that. But something that was said on the webinar that I attended today with the leaders from DHHS and the CDC, they said that this was something that the leader of the HIV division at the CDC said verbatim. The same inequities and disparities that lead to COVID-19 are also the same inequities that lead to HIV infection. The same inequities and disparities that lead to COVID-19 are also the same inequities that lead to HIV infection. So what are these inequities? What are these disparities that we're talking about? We're talking about people who live in poverty. People who live in poverty are more likely to contract HIV and also to contract COVID-19. Black people, race is really a predetermined, it's a determinant for our health outcomes, especially COVID-19 and HIV. People who face discrimination based on their identities. These are the inequities that we're talking about. So as a Black woman, the inequities that I face are those of Black people, and then also those of being a woman. So those identities intersect for me to face all types of discrimination. This is called intersectionality, and this term was coined by Dr. Kimberly Crenshaw. If y'all should definitely, she did a TED Talk on it. Y'all should definitely check that out because it's amazing, and it helped me to understand the unique struggles that I face, and then also helped me to understand the unique struggles of other people. So I named, like what I face as a Black woman, and then I can add other aspects of my identity in there as well. Like, I'm a dark-skinned Black woman, so colorism comes into play. I have locks, so texturism comes into play. I'm from Southeast DC, I'm a little ghetto. So that comes into play as well when we're talking about discrimination and things like that. But I want y'all to think about and imagine like a Black trans women, like the unique barriers that they face in the healthcare system or the disparities that they have that increase their risk for COVID-19 or HIV. You know, this person is trans. So we know how disgustingly we treat trans people as a society. You know, this person is Black and they are a woman. So it's like all of those things adding on. Then, you know, you add on a person with disabilities to that. That's like 4 intersecting identities, a Black trans person that is disabled. You know, you're adding all of these factors on that further push them away from care, because there are people who are straight up just ignorant, including healthcare providers. You know, they're like, a trans person will come into a clinic for service and the front desk person just acts like they don't know how to communicate with this other human being because they are trans. I don't know about y'all, but I'm going to leave. You're not going to treat me anyway. You're not going to talk to me anyway. I'm going to leave. Obviously, this is not the place where I need to receive care. So if a person is experiencing that at 3 different health sites, where are they ever going to get testing? Talking COVID-19 or HIV. Where are they ever going to go to really seek care if this is how people are going to treat them everywhere that they go? It's really important stuff to think about, and really important that we just take time to empathize, and so that we can better understand our own risk and how this continues in our communities. So I was really happy that, you know, that the leader said that. The leader of the HIV unit at the CDC also said that, you know, he talked about how distrust in African American communities, communities of color, and in the LGBTQ plus communities, it's not just historic. It's not just the Tuskegee experiment that happened. It's not just, you know, that how they used to discriminate against gay people in the 80s. This is right now. People are still facing, you know, this type of discrimination that causes distrust. It's ongoing. Yes, and so this comment that was just dropped in the chat, a lot of Black men hate going to the doctors just to get a wellness check. Absolutely. That is a very real thing that Black men experience, that Black people experience. And men in general, you know, women were more likely to receive care from doctors, and oftentimes we have more things to receive care for. But it is huge. That's like a huge issue. Like Black men just going to the doctor. And it's not just the Tuskegee experiment, as I just said. Like, that plays a large role. Like, you can walk up to like 5 Black men right now, and 4 of them are going to say that. But it's also the way that Black men are going to be treated once they enter into a healthcare facility. You know, like the way that they are going to be judged, the way that they are going to be cared for. You know, in the medical community, you know, there are physicians, licensed physicians, who are under the impression that Black people experience pain differently, that our immune systems work differently, and this dates back to slavery. You know, that these things that impact other people impact us differently, and so we get different treatment. And I don't see where the disconnect is, because the numbers say that we are impacted, actually more than, you know, some other communities, but we are still being treated as if we are just some superhuman that can't experience health issues, or that the health experience that we do experience are due to our own fault, not because of poverty, not because of socioeconomic status, not because of poor education and educational systems in our communities. Like, we can really like pile the list on, y'all, and really paint the picture for how all of these factors play a role in what in the HIV epidemic. And so what I'll say to people who are working in public health or social services or any type of human service work, really check those issues in the work that you're doing. Like check if you work in the educational system. Education is absolutely linked to HIV. So think about like how the education that you're providing to your students and the educational system that you work in, are students really connected with that? Are we really providing the education and the services that we need for students to reduce their risk, just their at life risk of what's happening? That's just one way to do it. Another issue of how HIV is going to be impacted by COVID-19 is that distrust that we've already experienced has been heightened, and there's increased skepticism of the medical community right now. And that is largely in part due to, our politicians and everything that we've experienced. We've heard that COVID was a hoax. We've heard that wearing masks are dangerous or a violation of our civil rights. We've heard all types of messages that are being internalized, and that will cause us to distrust the community even further. So while we're trying to, roll out PrEP, and we're trying to roll out the U=U campaign while also trying to roll out a COVID-19 vaccine that many people don't trust, it's just pushing that distrust of the scientific and medical communities further. However, we know that large-scale programming and policies are the most effective. So this is another reason why I say not to compare COVID-19 to HIV. It's because there have been large-scale things that have happened to work towards HIV, and those are the things that HIV prevention, and those are the things that work the best. We don't have a national plan to address COVID-19 right now. So that's why this is happening. Yeah, there's individual responsibilities, wash your hands, wear a mask, all of that. But that is placing the responsibility on an individual person. Whereas if the government was to put funding and effort behind addressing the issue in a comprehensive way, that we would see drastic changes. And then also, addressing those disparities that we talked about, those inequities, like that has to happen. We can't continue to not name race as an issue. Like this is people like, oh, it's 2020. Yes, it's 2020. That's the time. Like, this is the time to like call things out and name things as they are. Okay. Another way that COVID-19 is impacting HIV right now is that COVID is closing the doors for a lot of HIV resources, including mental health resources. People with HIV often suffer from depression, and also mental health issues and substance abuse issues are strongly linked with HIV cases. So if we are able to address mental health and substance abuse, then we will also be able to prevent HIV transmission. But COVID-19 is putting a block on a lot of that. And so that's something to really think about and something to really for us to consider. It's bigger than, just not being able to go to the movies or not being able to go to the club and stuff like that. There are people who are missing out on essential services that they need to really improve their lives, to manage their conditions, and to also prevent some of the issues that we're trying to get out of. COVID-19 is having an impact on all of this. All right. So I think that's all of my notes from that section, specifically talking about COVID-19 and HIV. But that's something to really just think about in your work as a sex educator. Think about how this is going to, how what we're going through right now as a country is going to impact STIs and HIV. And then also for those of us who have loved ones who are HIV positive, this is really the time to really check in with them, because so many of their resources are being limited, on top of any other disparities that they may be facing, like just lack of access to healthcare, transportation, anything like that. Okay. All right, so the last thing that we will talk about is reducing stigma. And there are so many ways to do this, and I want to hear from you all in the chat as well, like what you think about this, and what you're doing already, and how you can participate in reducing stigma as well. Like, I want to hear what y'all have to say about this. So I'll start by saying to educate yourselves. And this, when I say yourself, I'm talking to me as well. Those of us who work in this field and do this work every day, and those of us who, are cosmetologists or don't do anything related to this type of work. It's so important that we all stay educated and that we know the facts, because there's the misinformation really increases the stigma. And when we say stigma, we're talking about negative stereotypes, falsehoods that continue in our community, bad jokes, things like that. So it's really just important that we educate ourselves. There's so much to learn. There's always so much to learn. I have been doing HIV prevention work since 2009, excuse me. And there's still so much for me to learn. So educate yourselves, I would say, is that's the number one that I would go to. A comment in the chat: normalizing conversations surrounding sexual health. Absolutely. Like, we need to talk about sex, y'all. We have to talk about it because we see how it's impacting our lives. We see how it's so interconnected with our livelihood. We need to have these conversations. That's why I started this podcast. And while so many other people are doing this work, we need to have these conversations in an open and candid way. We need to have them with our children. We need to have them with our parents, our siblings. Like, yes, we need to talk about sex because this is the only way that we're actually going to be able to end the epidemic, as we say that we want to. Thank you so much for that comment. I'll also say that don't expect that people know. Really, don't expect that. I have met people who are 25, 26, 27 years old, and the most sex education that they have received is listening to the Birds, Bees, and Tease podcast. They went through middle school, high school, and college with receiving very little sex education. So don't assume that people know. Oftentimes, and I find myself doing this, writing people off as ignorant, when really that's what they are. They don't know the information. And so really taking the time to educate people and meet them where they are, so that we can work toward ending the epidemic. Definitely, you all do your own research and continue to read up on U=U and PrEP and other prevention methods that are surfacing, because they're so important. And the U=U, I think, is the biggest one for me in reducing HIV stigma. So if you're not working in this field specifically, I would say to think about, one, addressing the other disparities that your work focuses on that is interconnected with HIV, and also with communities that are most greatly impacted by HIV. And then also just understanding so that you can have you can participate in conversations with other public health people or with other health educators about U equals U in PrEP. It's really important. That's a good way to reduce the stigma, just to be able to have a simple conversation about it. And we know that people in public health oftentimes jump from different topics to topics. I've worked in mental health and substance abuse prevention as well. And those things we've talked about directly related to this work and moving the needle on the HIV epidemic. But the U equals U, if we can really get people to understand that coming in contact with a person who is living with HIV is not a death sentence for you or them, I think that that will really help with moving the needle on the stigma, for sure. I will also say, to reduce stigma, we need to all do more work to understand the unique issues that LGBTQ plus communities face. We need to do the work to understand the issues that Black communities face, and that includes Black people. We don't know everything that all Black people experience. We are not, just in a vacuum where the Black experience is the same for every Black person. So really understanding and doing the work to understand the experiences of other Black people who are different from you, and how that, their experiences impact their risk for HIV. It's really important to understand that. And then also getting a better understanding of intersectionality. I know I did like a chop job of explaining it. So I would encourage you all to do your own work and do your own research on intersectionality. Like a quick Google search will really set a lot of people free in 2020. Really. And then lastly, I'll say understand the risk and know the facts. This is not lastly. I don't know why I said that. I like to talk. Y'all know that. But understanding the risk and knowing the facts. We talked about lifetime risk according to race. And we talked about like the actual risk, like what's considered a risky behavior for contracting STIs and contracting HIV specifically. And knowing the facts around it. Like, we can't allow people to continue to spread misinformation. We can't allow that. We have to, even when we're in like a joking, fun conversation, we have to be willing to like put our foots down and be like, hold on, y'all, now that's not funny. Or, let me say this, because it's really important. It's going to save our own lives. Like me as a Black woman, knowing that 1 in 48 Black women will come in contact with, will contract HIV in their lifetime. I can't take that lightly. I can't. Like I know 48 women right now, who I could call and invite to a party. So I can't do that in good faith. Yes. I mentioned this earlier. Advocate for yourself. Like when you go to the doctors, ask them, do they know about PrEP? Like the doctors will ask you all about your sex life, ask you about your sexual behaviors and your sexual activity, and then not mention PrEP to you. You need to ask them, like, have you heard about PrEP? What type of clients or patients do you offer PrEP to? And for those of us who are doing this work, we need to not be afraid to educate providers. Educate the doctors. Yes, they have the degree and all of the years of experience and all of that, but that does not mean that they know everything. And we are specialized in doing this work. So that is what we need to do. Okay. Let me just make sure I'm not missing anything from my notes. I made sure I took a lot of good notes for y'all. One thing that I will say is that today is Giving Tuesday. And Giving Tuesday and World AIDS Day falling on the same day is amazing this year because it gives us the opportunity to really connect with a lot of organizations that are already doing this work. If you are in the DC area, I would encourage you all to get connected with Whitman Walker Healthcare and Real Talk DC. That is the organization that brought me up to be the sex educator that I am. And I will also encourage you all to connect with Heart to Hand. That is an awesome organization. that is doing a lot of this work in the DC and DMV areas. And I repost a lot of their stuff on the Birds, Bees, and Teas page. So get connected with them. And they have a campaign called She Equals Change that can really be helpful for you all's learning. If you're in the North Carolina area, get connected. There's a lot of awesome work happening in North Carolina, and Black-led work that's happening in North Carolina. So not a Black organization, but an organization that you all can connect with is the North Carolina AIDS Action Network. And that's just to name one of many. If you are in the Atlanta area, there are a plethora of organizations, especially organizations spearheaded by Black people and Latinx people, that you can give to, donate, connect with. Just a follow on Instagram goes a long way, because it allows you to learn information from what they post, and then you can also repost information and share, because a lot of people need to know this information, y'all. Like, like on my personal Instagram, people come there for the looks, of course, but I'm always going to spread information about, things that are happening, because they may not get it on the Birds, Bees, and Teas page, where I have, close to 3,000 followers on there, where just a simple repost of something onto my story will reach 200 people. Those are the little things that we can do to really move the needle on that. Okay. And then the last thing that I'll say is that we really need to, and I'm like a huge person for this, like put youth in the forefront of the work that we are doing, because young people are amazing. They are smart, they are knowledgeable, and they really want to do this work. So if you have young people in your house, you work with young people in the classrooms, start these conversations with them and let them educate you. Okay? So that's all that I have for y'all today. Thank y'all for celebrating, honoring, and commemorating World AIDS Day with me, for participating in this, for engaging in the chat box. I really appreciate y'all not letting me get up here and talk to myself. So thankful. I'm thankful and I'm grateful, and happy World AIDS Day to you all. Reach out to a survivor today, or just share some love or some compassion on your social media, because you really don't know who is being impacted by the virus. And so it's important that we just spread love and share love. Thanks, y'all. Love y'all so much. Thanks. And this episode will be, I was recording, so this episode will be posted onto the streaming platform, so y'all can check it out there too, or share with a friend. Thanks, y'all, so much. I'm going to post this on my IG TV as well, and I believe you can share it from there. So this will be up there. So if you just want to give us a quick little repost, we appreciate it. All right, y'all, have a good night.